Okay, well, thank you very much. And we would love to entertain any questions from our speaker. Does anybody have any comments or questions? Yes, sir. Now, please, when you do speak, identify yourself. If you have an institution that you want to identify as well, please do.
I'm a retired I'm Dr. Arnold Ritterman. I'm a retired internist. I am co-medical director of the Schenectady Free Clinic. That was an overpowering talk, very persuasive. I'd like to offer you personally a little comfort, and that is this is the same kind of battle was fought and is being won with tobacco. And this will inevitably happen. A practical suggestion, and that is since the makers of Coke and Pepsi-Cola and the rest of the sweet drinks don't care a hell of a lot where the money comes from, why not push in the direction of asking them to make their sweet drinks sweetened with a sweet love? Why not that as a practical tactic?
Well, of course, they have those products. They sell them as diet drinks. We don't have to tell them. They seem to be stuck on their core brand identity that they've spent 100 years building with all of the things I showed you, and really afraid it's kind of like a bubble. If you prick the bubble and find out this is very expensive water with colors and chemicals or sugar in it, people are going to ask, really, should we be spending so much money? In New York City, in those neighborhoods, food stamp recipients are spending 6 to 7% of their food stamp allocation on sugary beverages. 6 to 7% of the food stamps of the food insecure families is going for water, sugar water with coloring and flavor in it. And I think they're worried we're going to pop the bubble and they're not left with the whole business model.
Yes, sir, back there.
Last year's version.
Oh, could you identify?
Oh, I'm sorry, Jim Lytle and Ab Phelps and Phillips. Last year's version focused on the excise tax as opposed to just a sales tax on at the point of purchase. And some of the soda companies argued that they would just spread that cost in any event over all of their products, and it may not have shown up as much at the retail level. Did the change in strategy, you think, set you back? Would it be clear just to put the tax right at the point of purchase?
Well, remember, the first time around it was a sales tax, and we heard all the reasons that was impossible and wouldn't work. And then when we do it as an excise tax, there they flipped the other way. Again, it's one of my naked straddles. We never got down to the issues of how do you do it. It would be an interesting thing if our state decided we needed this for health, and this industry said, we don't care about health. We're going to spread it so you can't see it. I would love to call them out on that. Most experts prefer the excise tax approach. Bob Medna could probably explain more than I can about that.
Bob Ward from the Rockefeller Institute. The basic approach is to create financial incentives for people to stop doing something that's unhealthy. In the realm of insurance, New York and eventually the rest of the country is doing the opposite. We eliminated the idea that people should be charged more, or people should have be able to pay less for their insurance if they have healthy behaviors. Can you talk about that? Is that a contradiction of the basic premise?
I think, it's not a contradiction of what we want to do, but it does move at least the insurance market in a different direction. Federal reform took it farther down that road. I think you're only allowed to do a threefold premium adjustment for age and one for tobacco, and those are the only adjustments needed under the federal new standards for insurance, and that does have an impact. We have modeling and studies that say, in this case, it's more important to have the price disincentive to buy the sugary drink than think you can accomplish as much by incentivizing the fruits and vegetables. A group out of Buffalo modeled and experimented with that, and they actually found that the family that got an incentive to buy more vegetables might do that, but it also freed up income to continue or buy more of the sugary drinks. We need the negative price signal, not just a positive incentive.
Yes.
Hi, Peter Slocum with the American Cancer Society. The experience with legislators on tobacco and other related issues, there are varying degrees of enthusiasm for public health measures like this, obviously, over time. Did you find any allies in those communities where, in the Bronx, for instance, where you were practicing medicine all those years, did you find anyone who was sincerely willing to grapple with this issue?
Well, Felix Ortiz from Brooklyn in the Assembly has been a big and loud proponent. Actually threw in some other proposals, sort of piled into the market with something about salt and something else. Privately, certain senators and Assembly people would say, well, you'd find me in support, but until the whole bunch goes, we're not going to speak out. That's that certain particular dysfunction of our legislature, the narrowness of the division, the threat of the upcoming election, the kind of leverage out of one district. You know, a Bronx legislator's rock solid safe, but he's very worried about what will happen with the race in Oswego. And Oswego may have a different set of concerns up there. But privately, yes, I heard some relatively positive things. A lot of them are, why don't you say more, why don't you run more ads? And of course, you know, we don't have $13 million to run an ad campaign.
Thank you. I'm Sherry Tomasian from the American Cancer Society also. And as incredibly compelling as that talk was, there was one thing conspicuously absent, and that is any advice for those of us that are going to be around next session. I know you said you'll be looking for a job, and some of us won't be. And you know, we intend to carry this torch. And I'm wondering if you think that there's any sense of any slight shift in this issue with the new administration.
I can't say. I mean, taxes seem off the ground. I think there was a window. It didn't open. It wasn't a big window. But this last session, there was a window between the deficit and the bad alternatives and all of that. We didn't get in the window. I don't see a window like that. But moving this into the public sphere, and you know, that Law and Order SVU sessions, 8 million people saw that the first time it ran. Julian Robertson's on CNBC saying that we ought to do this. We may need a couple of cycles of that kind of a drumbeat and watch obesity and diabetes and military rejections get worse before this comes back on the table. And again, the story of tobacco tells you that. Often the first time you propose something, people say you're crazy, it'll never happen, you're nannies, you're Nazis, you get all of that. 3 or 4 or 5 years later, it's done, and people can't imagine why it took so long to get it done.
Jim?
Jim Folane, Rockefeller. So, I'm an economist, sympathetic to a tax. But there's another set of remedies out there. The book called Nudge, you've read that?
Yes.
You know, the experiments. Those are other kind of remedies,
yes.
Especially. What's your sense? I mean, does that have a powerful impact in this area? Or
Nudge will do things, you know, get them out of the schools, put the better things at the front of the case, where you put things in the checkout line. There's a lot of things you can do to subtly influence behavior. Yes, yes, yes to all of that. You don't. One of the risks we get into is when we focus on one policy, people say, but what about all those other policies? This is not to the exclusion of all of those other good things that can be done. I believe the real focus, and it needs to be correct this price, this underpricing, oversizing, advertising, marketing signal, and a lot of the other things will have a lot more effect. If we just, if we had left cigarettes cheap and available, I really don't know how much good the aversive advertising would have done. We made it really expensive, and then we said, here's aversive advertising to drive you to the quit line. And I think you need the combination of policies.
Yes. Oh, okay. Yes.
Silver. I'm a civilian.
She was with the department a month ago.
I know that you mentioned a lot of the districts in the Bronx have food stamps as one of the criteria, and I know that there's a proposal that the city has put forward in conjunction with the state about having the federal government approve that food stamps not support these purchases. What is the possibility of that having, surviving or making a
Well, Tom Farley and I were in Washington Friday with Robert Dorr and people from ODNL here in the state to pitch exactly that to the Department of Agriculture, to the Undersecretary Concanon. And that's actually a map that we showed them. And I said, I practiced medicine there for 20 years, and I ran a Boy Scout troop. I did Boy Scout physicals for those 20 years and watched my Boy Scouts get fatter and fatter and fatter over those 20 years. And I had the experience of having an overweight Boy Scout that couldn't keep up on the hike, and I'd stop him, and I'd open his backpack, and I'd pull out 2 20-ounce Gatorades out of his backpack. And I hope maybe that penetrated to the Department of Agriculture. On the way in, somebody whispered that the origins of the food stamp program, which it still has some that cling to it, was a way to dispose of excess agricultural commodities. And it's a real shift to say, no, it's a nutritional program for low-income people.
Erica Martin, Rockefeller College and Rockefeller Institute. So there's such obvious parallels that you've alluded to before between tobacco and food. And I'm wondering to the extent to which policymakers have really thought about drawing from historical lessons and applying, and why or why not it might work in this case. So as you said before, clearly we don't have enough money in public health to really combat all the ads, but we could think about maybe some litigation to look at fair ad doctrines, or thinking about what is true or not true about the ads and can we regulate it that way, which is something that was pretty successful with tobacco. So I was just wondering sort of your thoughts on...
I have a loose leaf about this thick of articles about the legal approach. It would probably target marketing to children. I mean, frankly, I don't understand. We tell children, never take candy from a stranger, and then we let strangers sell them sugary beverages with Santa Claus and penguins. I don't think we violate a First Amendment right by saying, children, just take it up to age 8. Up to age 8, children really have difficulty distinguishing between true and untrue. They believe in Santa Claus and fairies and all of that. And that's when they try to embed these images in that nucleus accumbens. I think we ought to legally create an advertising-free zone. And I don't just mean sugary beverages. I mean an advertising-free zone up to age 8, and then start to put them out in the marketplace. The Ursula Bauer, what's her title at the CDC, Phyllis? Ursula Bauer, who Tom Frieden stole from us to run the chronic diseases campaign at the Centers for Disease Control, came up through our tobacco control program, wrote a very compelling 15-page white paper about taking the tobacco control lessons and bringing them over to chronic diseases, obesity, and diabetes. And to some degree, that's been a Bible for what we're doing here. And she's now down in Atlanta seeing if we can do that nationally. I will say, though, that I think it's so much more important to push this at a state level. I don't see national policy, whether it's Democrats or Republicans, moving this along. You've got You've got John Lewis and Saxby Chambliss in Georgia. You've got the Iowa caucuses for every party. And I don't think this is going to happen nationally before we get some states to do it. So I'm a states person, not a states' right person, but I'm a state person about things like this.
Are there any attorney generals out there that are putting together a
There's been a little bit of noise, not a lot. You know, the trouble you run into is it isn't tobacco in the end. And you kind of feel bad about vilifying a perfectly nice product in moderation. Maybe that's my nucleus accumbens implant telling me that, but I feel a little bad about doing that to Coke and Pepsi and beer.
Okay. There was, not to move it, not to take away from the states, but in the last Farm Bill, and I guess going back to the snippet out of the Law and Order piece, there are a lot of subsidies on the for products and that go into unhealthy foods. And in the last Farm Bill, there was a larger public health presence in the discussion. I don't know whether you think that the public health community is likely to mobilize even more or be more effective. I mean, I don't know whether they can be more effective. That probably depends on what the Congress is going to be like. But there is that even though they didn't win much in the Farm Bill, their presence was much more evident than I can remember in any discussion of agricultural subsidies.
Yeah, I'm not all that encouraged about Washington. There's what I was looking for. If you look at what happened in this election, that sea of red in the Midwest and all of that, I don't think the politics on the national level are going to be very favorable at all towards limiting farm subsidies, curbing, they're going to want to curb the nanny state, the big government. We're going to have to learn how to talk to people about that. But I don't think our answer is going to be in the Farm Bill. The high fructose corn syrup subsidy probably accounts for a 5% price advantage. The bigger cost of sugary beverages is not that subsidy, it's what the economists call the externalities, the downstream costs of obesity, diabetes, hospitalization, lower productivity. That's the real cost that isn't built into the sugary beverage, not the 5% advantage of high fructose corn syrup.
And did you also, at the state level, did you find much support from the medical community?
Oh yeah, the healthcare community, the hospital industry, public health. I should not have all said this was me out there against the world. They bought advertisements, they campaigned, and it was every day, what can we do? But you know, you're churning out op-eds and sending letters to the editor, you're volunteering to talk. We're really great about getting in front of audiences that already agree with us. I mean, that's the trouble with being supported by the editorial page writers in the New York Times. You're writing to people that agree with you. How do you break through? That's why I think the popular level, the Law and Order SVU, could we get on the Stewart show? Can you get in that level and start to build it in? You know, skinny, well-educated, high-income people aren't the target group. They already agree with us.
Yes, sir, in the back.
Where were the health insurers on this, and why not?
Oh, Carl Young, Social Security.
I don't remember them coming in. I wrote a letter that I sent a bunch of them and said, you know, there's something going on here. Do you want to join us? You know, a lot of what hurt us was that dead on arrival thing. The dead on arrival meme was a very skillful tactic to tell groups, why run a risk? Why stick your neck out on this thing? It's dead on arrival. And then, you know, under the canopy, they're pumping in $13 million because they're afraid it's not dead. And I think we sort of disinterested some potential advocates because they swallowed the dead on arrival derivative.
Any more comments, questions? All right, well, thank you very much.